Dr. Heather Moore, owner of Total Performance Physical Therapy. We're going to go over stretching for your shoulders. So what I want to talk about first, though, is be careful when you are talking about stretching your shoulders or doing stretches for your shoulders. It is very important that you understand, are your shoulders tight or are they weak? So I swam my entire life through college, and my shoulders ache all the time. And it feels like they need to be stretched, but in reality, the more strengthening exercises I do for them, the better they feel. And it's not hard strengthening exercises in terms of lifting a lot of weight. It's a lot of planks. It's a lot of what we more consider shoulder stability exercises. And if you go to our YouTube channel at Total Performance Physical Therapy, you can see some more of these shoulder stability exercises. But it's important that you differentiate that, the fact that a lot of people, when they feel tight, they feel like, oh, I need to stretch. But in reality, a lot of times that feeling of tightness actually means there's some weakness going on. Same thing in the lower back, that tight lower back feeling. Sometimes maybe it isn't tightness due to tight muscles, but it's tightness due to weakness. So something that you want to consider, have evaluated. We offer free consultations at Total Performance Physical Therapy if you want to come in and have it just looked out. But it's really important because if you're stretching a joint like back or shoulders that's already stretched, you're not really helping anything. So if you're just going to stand there and do these stretches and you're like, oh, these don't work, or I'm still really feeling tight, it's because of the fact that it's not stretching that you need, it's more strengthening that you need. So just kind of a clarification on that point. So I'm going to show you 3 shoulder stretches today that you can do throughout the day. You want to hold these about 30 seconds and do about 3 reps of them. They're pretty easy, so you can do them multiple times throughout the day. But again, if you are someone that's doing these constantly and you're like, oh, I'm still feeling tight, you want to make sure that you're really getting evaluated and checked out. Is this more weakness or is this actually tightness? So the first one we're going to do is just more of a front of your shoulder, front of your chest stretch. So you're going to clasp your fingers behind your back and then just rotate your shoulders back, and then you're going to lift your arms up as far as you can. None of this should cause pain. So if it hurts, you want to stop doing that. Some people may have a problem even clasping their hands behind there and straightening their arms. If that's the case, just start with a bent elbow. Don't really worry about moving your arms out. Your goal is going to be eventually to straighten your arms out. Then you can move them back, okay? But you don't want to do anything like this because that's not really hitting the areas that you want to hit. So first goal is clasp your hands behind your back. Second goal is to straighten your elbows out and then move your arms back away from your body. So that's kind of a 3-step process. Wherever you are in that process, that's where the stretch is. So if you're here, you're going to hold that 30 seconds. You're going to do about 3-6 of those. And you're just going to continue to work until you can grab your hands and then move them back. The second exercise that we're going to do is a lat. So it's more for like the back of your arm, shoulder area. So this is just going to be lifting your arm up over your head and pulling behind your head. Now, some of you may get a pinching feeling with this. That's not okay. That's a sign that something more is going on, and you definitely want to seek some medical treatment for that. So you don't want to push through any pain, but you want to bring that elbow up and pull it back as far as you can. Again, you're going to feel a gentle stretch kind of right down here through that shoulder, through that tricep, through the side of the body. Shouldn't be painful. You should stretch it as far back as you can. And again, hold that 30 seconds. And then the final stretch that you're going to do is just more of a crossover stretch where you're going to hold your elbow and bring it across. You're going to feel that stretch mainly in the back of the shoulder. All right, nice and easy. Again, doing that 30 seconds and only holding that 3 to 6 times. If you sit at a desk and you're really sedentary with your posture, these can be great ways to loosen up. You should do them a couple times a day. But again, if you're really doing them a couple times a day and you're not feeling any results and you're still feeling tight, could be more weakness going on that you need to address. If you or someone you know is suffering with shoulder pain or shoulder tightness and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.